Welcome to Ecstatic Yoga. I'm so glad you're here. Welcome to our Ecstatic Yoga, Prenatal Yoga and Pregnancy class lesson today. In Healthy Pregnant Woman, Yoga Alliance claims the practice of yoga as safe and beneficial with the consent of your doctor or healthcare practitioner. If you've already been practicing yoga, and your body has a familiarity with the poses and the practices, then practicing yoga will be a gentle and easy transition, using the contradictions and modifications as needed, please. If you are new to yoga as a pregnant mother, you'll need some extra care and practice. Please begin with a beginner class, a restorative or a yin class, or a specific prenatal class if you are a beginner to yoga. And pay special attention to the contraindications and the modifications. Always listening to your body and take special care to honor and nurture your body's messages. As you practice prenatal yoga, honor your body's needs at all times. Anytime you may need a break, a pause in your practice, or a rest, please take that. You don't need to keep up with the class. It's always your practice. Pay special attention to allowing versus forcing and striving, and create gentle openings. Benefits of prenatal yoga: prepares the body for labor. It builds pelvic strength, creates better focused discipline and concentration, which will benefit the entire 9 months of your pregnancy. It will benefit you while you're in labor. And of course, it'll benefit you as a mother with a newborn baby. Relieves tension in the pelvis while inviting the cervix to relax and open. Maintaining strength, balance, flexibility for quicker recovery after pregnancy. It improves sleep, which you will need, especially after the baby is born. It may help your nausea during your pregnancy, that morning sickness, and also the back and body aches. Prenatal yoga can reduce stress during your pregnancy, during your labor, and also as a new mother. And it also, yoga may relieve depression from the hormonal fluctuations. It can help to balance and support the body system back to their natural harmony after the baby's born, as well as raising the vibration, your emotional vibration, to more elevated states. Also benefits by stretching the body regularly, can help before, during, and after labor. Breathing practices, your pranayama keeps the energy body clean, as well as the toxins regularly cleaned out of the body, and a cleaner, healthier, vitality-filled blood for the baby. The pranayama can also help you while you're in labor with your breathing. Prenatal yoga can also help emotional support by practicing the philosophical principles of becoming one with the eternal self, the divine self, being the witness to the distractions and disturbances of the mind rather than being engaged in them, deepening our own self-love to yoke with our divine self more deeply, become more deeply in love with that divine self. This sends positive vibrations to the baby, less time for distraction and mental disturbance, and more time vibrating in present moment peace. We advise all pregnant women to talk to your doctor or healthcare practitioner and get their advice about practicing yoga during your pregnancy. Contraindications for prenatal yoga. Always get your doctor's advice. If yoga is new to you, let your doctor know and get the advice of your doctor. If your health is not vibrant and you are dealing with any type of health issues, please get the advice of your doctor. Avoid any and all poses that put pressure on your abdomen. Avoid all breath retention like Viloma or forced breathing, vitalizing pranayamas like Bhastrika or breath of fire. Avoid supine poses, laying on your back for only short periods of time while you're pregnant, and especially in later pregnancy when the placenta and your uterus become heavier. Avoid belly down poses that could create some pressure on the abdomen. Avoid twists at the abdomen area, standing, seated, or supine. Avoid twists completely during your first trimester. And on your second and third, practice only open twists with the approval of your doctor. Avoid strenuous or advanced poses that cause stress or heat in the body. Avoid balancing poses that are challenging. Use a modification or a wall to support you. Don't want you falling. Avoid extended inversions. I was practicing yoga before I was pregnant for many years. However, I did cut my inversion time to a half or less of what I normally would stay inverted. Avoid deep back bends. No need to overstretch the abdominal muscles. Avoid any pose that affects the blood pressure, either too high or too low. Avoid the feet closer than hip width apart in standing poses. You can open up that and widen that stance as wide as you want to allow stability and balance and room. As you're going into a forward fold, we need room for that baby. Avoid hot yoga. Don't want your temperature to get above normal. That can affect the baby. So contra-indication discussion, lifestyle and general health. Like a lot of things, running, Pilates, as well as yoga can be continued during periods of your pregnancy if it is already an established lifestyle practice. I ran track in high school and college, so I ran up to 6 months pregnant. However, I had been running all my life competitively. I wouldn't recommend a pregnant mother to run if her body wasn't used to it and it hadn't been a practice for several years. With yoga, if you are new, you can begin with a prenatal class or a yin or restore and see how your body feels. For most healthy women, gentle stretching and embodiment will be good for both mom and baby. Yoga can provide great benefits for a smoother pregnancy and labor by keeping the body flexible, open, and strong. Although there are still modifications to make and things to avoid, if you are struggling with health conditions, limitations, issues, get a doctor or healthcare practitioner's advice. Abdominal strain or pressure. We begin mindful of where the baby is growing in this sacred abdominal area. Any pose that puts any pressure on this area should be avoided. Belly down poses during pregnancy are contraindicated, especially after week 4. to avoid putting any pressure on the abdominal area. As your pregnancy progresses, the less you will want to be on your belly, as it can constrain or put pressure on the uterus. It is not recommended to do anything stressful in the abdominal area. Avoid abdominal workouts like sit-ups, crunches, boat crunches, plant, or your plank push-ups. In plank, come down to the knees rather than full plank. No plank push-ups. Poses like crow should be avoided completely. Breath retention, extended holding of the breath or asana are contraindicated. When we are pregnant, holding the breath for even a short period of time can decrease the oxygen levels in the blood briefly. And even a momentary drop in oxygen is not good for the baby. This can be a risk for the baby because any oxygen decrease or deficiency in the blood can cause a deficiency in forming cells of the baby's body. Laying on your back is also contraindicated, especially during the second and third trimester, especially for long periods. Unless you have a waterbed or very early in pregnancy, you will find laying on both the stomach and the back a contraindication and uncomfortable. On the abdomen, you don't want to put any pressure on the abdominal area, and laying on the back, as the weight of the uterus increases, you put pressure on the vena cava, the largest vein in your body that carries blood flow from the extremities of the back of the lower legs to the heart, the lower body. With the extra weight of the amniotic fluid, placenta, and the baby, a pressure can be exerted on the vena cava when we are laying on our backs. Normally, when we're not pregnant, this isn't a problem, yet it is a problem with the increased weight of the uterus pressing against the vena cava. Pressure on the vena cava due to extra weight of carrying a baby can restrict blood flow to and from the uterus, which can affect the baby. Pressure on the vena cava can also decrease blood flow to the mother's brain, creating brain fog, depression, or dizziness. None of this is good for baby or mom. There are modifications to enjoy a comfortable savasana. Props and pillows truly save the day. Early in pregnancy, using props and pillows on your back may work, always with the advice of your doctor. Also, laying on your side with props and pillows. Using props and pillows are a savior. You can place a pillow between the legs as you lay on your side, as well as a pillow for your head. Options for savasana pose is laying on your side, a seated savasana, or reclined savasana or goddess with pillows. And the best way to do reclined is to have a bolster with a few blocks underneath it. The first one can be lay long, and then the one behind it you can stack up tall, so that bolster will be up, so you'll be laying up rather than flat on your back, but you'll be completely relaxed and be able to move into savasana. Twists. Twists are also contraindicated. Twists occur in the same abdominal, twists that occur in the abdominal area where the baby is located. Therefore, it is recommended to not do twists in the abdominal area. But you can do twists in your ankles, your wrists, your necks, your shoulders. You can be beneficial. If you want to add twists later on in your pregnancy, they're always contraindicated in the first trimester. But later on, you can modify abdominal twists to be open rather than closed, and twist at your shoulder rather than the abdomen. Um, yeah, and another contraindication is advanced poses. Avoid any and all poses that are strenuous, that overexert or put the body in pain or stress. Advanced poses have more risk of injury, and that is not a risk you want to take with a precious passenger inside your body. Any pose that increases the blood pressure above normal or causes overheating, dizziness is not recommended. Sticking to easier, more restorative poses will create far more benefit for mom and baby than advanced or strenuous poses. Balancing poses. Key point is if there is any risk of falling. Avoid balancing poses while pregnant if you have any risk of falling. If you have been mastering and practicing balancing poses prior to your pregnancy with the doctor's approval, you may continue. However, it is recommended that you have a wall or chair or something solid to hold if needed. It's not worth taking any chances when you're pregnant. When you're pregnant, even if you have been practicing balancing poses prior, you must be aware of your center of gravity within your body shifting during pregnancy. Be mindful of that shift of your center of gravity while practicing balancing poses during pregnancy. Crow would be a balance you would want to avoid during pregnancy. When I was pregnant, although I rode my bike almost every day since I was 5 years old, I didn't ride my bike at all while I was pregnant. I felt if I fell off my bike pregnant, it could be far more than just skinning a knee. It could affect the baby, and I wasn't willing to take that risk. Be cautious and honest about your level of mastery in balancing poses before practicing while pregnant. Always have a support, a wall or a chair available during your balancing practices. Extended inversions. Inversions, unless in your practice before pregnancy, should be avoided. And extended inversions always avoided. Balancing inversions like headstands should be avoided. However, if already masterful, practice only for a very short time period and against a wall for support. And this is only if it is you're confident in previously practicing headstands. Any extended time inverted is not recommended for pregnant women. Always get your doctor or healthcare practitioner's advice before practicing any inversion. Deep back bends. Back bends move the spine into extension and actually extend and stretch the abdominal muscles. Deep back bends can actually stretch the abdominal muscles more than is needed while pregnant. During pregnancy, diastasis recti, a separation of the abdominal muscles, can occur if overstretching of the abdominals. Blood pressure. Any yoga practice that elevates or decreases the blood pressure out of the normal healthy range should be avoided. Keep the mother's blood pressure at healthy range is important for a healthy pregnancy. Feet close together is always contraindicated. To help with balance and to create space for the belly, it is advised to bring the feet into a wider than normal stance in standing or forward fold poses. Hot yoga. It is important that a pregnant woman's body temperature does not exceed the normal 102 during pregnancy for any extended time or it can affect the baby. Hot yoga is not advised because it can elevate the body temperature above normal. Also, hot yoga can dehydrate the body quickly if you're not careful with liquids. Both overheating and dehydration are not good for a developing fetus. Modifications for pregnancy. Savasana, relaxation pose, props and pillows. Use of pillows and props under the body. You can create an elevated bolster using blocks underneath. And as I had mentioned earlier, the closest one flat, the further one standing, and using that bolster as a nice upward reclined posture, where we're not putting any pressure on the Thina cava. Using a bolster or pillow under the knees and pillows, and the pillow under the back can help with savasana relaxation. Very cushy, comfortable pillow. A reclined goddess with pillows and props bringing you up and bringing those feet together. Savasana on our side. Modifications. You can use pillow or bolster between your knees, or use a pillow or a block to rest your head. Modifications for balancing poses. Use a wall, chair, or solid support to hold and help maintain your balance. There's also, you can modify the pose where in tree you may have just the balancing toe connected to the earth. So you can make it a little easier for yourself where the majority of the weight is in the standing leg, but the opposite leg has just a tiny bit of weight to create some extra balance. Forward folds like Uttasana or seated, or any standing or seated forward fold, you'd like to widen the feet for more stability and allow more space for the baby. So keep things wide. If you're moving into a seated forward fold, open those legs up and do a wide forward fold. If you're coming down and standing, moving into Uttasana, open up the legs wide as you need. Make room for the body and to create balance and stability. Discover what creates the best balance and adjust the feet accordingly. Feet will need to be further apart than normal for better balance and create space for the baby. As you progress in your pregnancy, you will find you may increase your stance for more space and stability, and there may be a time where forward folds don't work for you, and that's okay. Seated Sukhasana or easy pose. Bring a pillow under the back part of the buttocks to elevate the hips and create a slight forward tilt in the pelvis for best comfort. Twists. Practice only twists at areas of the body other than the abdominal area, avoiding any constriction of the baby bump. Practice open twists where the baby bump is completely free from any twisting, avoiding all twisting during your first trimester. An open twist, if I can show you this. So if you're coming and you're twisting like this is a closed twist because my arm is in front of the belly and I'm creating some restriction. But you can bring the hand to the other knee and twist. And you can also twist to the other side. So keeping it wide open where there's nothing, there's no knees or legs, there's no arms, keeping a nice open twist. It's the best way to do your twists. No knees or arms twisting over. The twist occurs at the shoulder and the clavicular area, not the belly. So focusing on moving those shoulders more than the belly. And twisting to the opposite side rather than over a leg and or arm. Abdominal twists unless open can restrict the area the baby is growing, and it can restrict blood flow to the precious infant. Plank, either avoid if strain, any strain to the stomach muscles, or move into half plank with knees to the ground so as to not create stress on the abdominal muscles. Pregnancy is not a time for power workouts. So as you come to your knees, you can come to the chin and chest, and then while hovering, rather than coming all the way down to rest on your belly, you can simply swing up into your up dog. That's a nice modification. Child's pose, coming into a child's pose by first opening the knees wide so the belly can rest between the knees and there is no pressure on the belly. Once you have a space for the belly with the knees wide open, then lower down into child's pose. And that's what a lot of women like to do anyways, and men, is open up those knees as you move into child's pose and give space for the abdominal and the belly to rest inside. Deeper back bends are also a contraindication, and they can be modified by practicing gentler back bends, like a supported bridge, rather than using all that abdominal strength and the back bend to lift yourself up. Use a block or a pillow or a prop to have a restorative bridge. Gentle baby cobra and fish, stretching only on that upper back. So in the fish, you'd stretch and open the upper back, not the mid or lower thoracics. Rather than a full camel, a full wheel, or a full bridge, or dancer pose, you can go into half poses with less extension of the spine in all of those back bending poses. Use blocks under the hand for your up dog so you create more space for the belly, for the chest to lift the body, and have no restriction on the belly. Supported or gentle bridge can be a modified back bend. Cow is also a great modification for back bends, as the extension is much gentler than other back bends, and the combination of cat and cow bring flexibility in the spine, which will help with pregnancy. In a camel pose, you can move into a slight back bend with the hands behind your back. This can be your camel pose. You're on your knees, rather than moving all the way down to those heels. Pay attention to your limits and back off if needed. A good modification for inversions is just bringing the legs up the wall with your back propped up on the bolster with those blocks. So you're up, your legs are up, there's no pressure on the vena cava, and you're getting a little inversion. And always keep your inversions at much less than normal. And moving on to contraindicated poses. So these are some poses, just a few poses that are contraindicated. We'll go by category. So twists. It'd be seated, knee down, and all closed abdominal twists. Revolved triangle, revolved side angle, revolved chair. Supine, laying on the back poses. Savasana or relaxation without props. Happy baby, baby. Reclined hero, reclined cobbler, reclined twists, reclined bound angle or butterfly, reclined hand to foot, plow or plow pose. Belly down poses. Bow, locust, sphinx, cobra, a full cobra back bend. Abdominal work, boat crunches, or any type of stomach crunches or sit-ups that are intense. Deep back bends, camel, wheel, bow, up dog, fish, and all the revolved triangle, revolved side angle, all are revolved poses. Inversions, headstand, handstand, half shoulder stand are all not recommended unless with your, none of those are recommended. And balancing, crow, headstand, any balance that is not supported or is strenuous on the body. I hope this helps you with some general information on prenatal yoga, on some modifications, contraindications on what to avoid, and making that precious, precious human gift, that life, be the most important during this time. And remembering, the more you can keep your vibration high and your vibration in a positive state, those vibrations are being absorbed by your baby. So using the practices of yoga, meditation, pranayama, gentle pranayamas, no holding your breath, and the study of jhana yoga, doing your study of Patanjali and his 8 limbs, Raja Yoga, Karma Yoga, service during your pregnancy. All of these will be helpful in raising the baby's vibration and giving the baby a sense of calm, so those powerful endorphins will be filling the baby and the baby's energy field. Thank you for joining me for ecstatic yoga and prenatal. I am Grace, wishing you a most beautiful and most blessed day. Namaste.